One area of dentistry that is probably the most overlooked that I've noticed over the past 25 years is the matter of temporomandibular joint disorder, or TMJ disorder. The temporomandibular joint is right here, and for many people, due to stress, primarily due to stress, sometimes exacerbated by certain anatomical features that they may have, a lot of stress and strain is put on the muscles, causing a chronic spasm. You'd be surprised how many people have incredible amount of difficulty opening a reasonable amount. I often joke with them, how do you even eat? How do you get a spoon in your mouth? That's how compromised their range of motion is. And basically it's a matter of function. If you're unable to open wide, that's not something that you should learn to live with. Now, apart from the stress that we all have in our lives, some people manifest the way they deal with stress differently. Some people clench. Some people grind their teeth. Some people just kind of hold their teeth in an active position. If your teeth are touching all the way, that is not a position of rest. I'm not even talking about clenching hard. The normal rest position is when our lips are closed but our teeth are slightly apart, and that's when we're at rest. And unfortunately, far too many people are rarely in that position. And the other problem is that a lot of people clench and grind their teeth in their sleep, and unfortunately there's nothing they can really do about that. It's something that goes on when they're unconscious, and it is a manifestation of the stress they're going through in the day. But the good news is there's something that can be done for it. In about 80% of the cases, we get very good resolution with the use of a night guard, something that you wear, can fit either on your upper or your lower teeth. The ones I design generally only go from lateral incisor to lateral incisor, so it's not this big bulky thing. And what it does is it opens you up a few millimeters, and as a result these muscles cannot engage and they cannot activate. They're forced to rest. For many years I made the classic U-shape horseshoe type night guard, and they do work as far as preventing edge-to-edge wear, but some people, when they wear these appliances, it actually stimulates them to clench more in the back. Having this foreign object in their mouth makes them clench more. So the teeth will not be worn, but the muscles are never getting to fully relax. By only being engaged here, there's nothing to touch in the back, and the muscles have no other option but to just be inactive. There are other adjuncts that people can utilize, massage therapy, even acupuncture, physical therapy, to try to get these muscles to relax. Because I assure you, if you have muscle spasms in your jaw here, you most likely have muscle spasms in the trapezius muscles, your scapular muscles, and even in some cases, people that I've referred to physical therapists have been found to have imbalances in their hips, constriction in the rib cages. So this is a starting point and a catalyst for a whole domino effect of muscle spasms. It's much more, the problem is more common with females than males, but I would say that both genders are equally bad at identifying the problem and addressing the problem. For many people, it's a situation where they learn to live with it, and they think it's a variation of the norm, but it's not. That's actually pathological, and it should not be accepted as an idiosyncrasy or a quirk. Because if you can't open your mouth fully, you're not functioning normally.